Hello and welcome to another yet interesting edition of Obstetric and Gynaecology. I'm your host Morgan Epikaizo Lukama Jr. Ensure to subscribe to my YouTube channel and hit the notification button. Okay, so without wasting much of the time, what we're going to do is that we'll look at some of the objectives that we need to consider when dealing with the history and the history and the physical examination of obstetric and gynecology. Okay, so to start with, we have what we call we need to get the general information of the patient. So under general information, this is where you get the details of the patient, like you get the names and whatnot, their names, and the age and everything. So that is under the general information. Then history of current pregnancy, like if at all you need to look at the history of the current pregnancy, past obstetric history, the past pregnancy that the person, your client, have had before. Then gynecological history, you also need to check the gynecological history. How many pregnancies is the client that you're dealing with have had? Okay, then you should also inquire about other systems. Okay, so inquire about systems, that is under system examination, systemic examination, you check. Then past medical as well as the surgical history is very much important. Then psychiatric history is also important. Family history, social history, drug history is very important. Allergies, find out if your patient has got allergies, and also we'll also look at the summary. So these are just objectives that I've run upon that we'll look at in obstetric and gynecology. Okay, so these are just the objectives that we should take note of. Okay, so let's move on to the under general information. What are some of the things that you need to consider? So in general information, the important cardinal information is that the name of your patient, the name of your client. You need to take the name, you need to get the information, the name of your client, the age, the presenting complaint. Okay, so under presenting complaint here, we're referring to the patient's word, not medical words. Okay, so we are referring to the patient words, not just the medical words, or reasons for attending. Okay, so you ask the reason why they have come to visit, what has brought them to the oasis, to the clinic or at your station. Then gravidity. So this one here, it is just the total number of pregnancy, regardless of how they ended. So you need to know this information, find out. There are others. So gravidity is very much important because you need to know the number of pregnancies, regardless of on how they ended. Others ended, maybe other pregnancies maybe can be they ended through miscarriages and also abortion and whatnot. So you need to get this information. It's very much important and vital. Then parity. This one also is very much important in general information because it talks about the number of lives birth at gestation. Okay, the number of live births at any gestation or stillbirth after 24 weeks of gestation. So in here, you also need to consider the number. The number is very much important. Those babies that the number of lives birth at any gestation period. Remember, the gestation stage is the period between uh, uh, when one gets yes okay, so gestation period is just a period between when one gets like conceive up to the time that that person will now give birth. So that period we call it gestation period. Okay, then besides that we also have another one which is called stillbirth. Like under stillbirth, this one maybe after stillbirth, if it's the child was born after 24 weeks of gestation. Okay, 24 weeks of gestation. So those are the number of lives of live birth. That is what we call the parity. Okay, then GA, it is just the gestation. Okay, so under gestation, the period from conception up to the period of delivery. Then you also need to check for the last menstrual period. Ask your client when last did they had their menses. Okay, then you should also ask your client the expected date of delivery according to the Nagel's law. Okay, Nagel's law. According to the Nagel's law, it is you need to add 9 months plus the 7 days of the first day of the last menstrual period. For example, if let's say the expected date of delivery is okay, if let's say for example the last menstrual period was on 20th July 2008, and then the expected date of conception was or the expected date of delivery April 27th 27th April 2009. So on this is just the Gregorian date, but if it is in Jerry, so you need just to add 18 days instead of 7 days from the expected. From you add 18 days. You add 18 days to the 9 months, and then the overall cycle is 28 days, and it can be from 21 to 35 days. That's under the overall menstrual cycle. So if it is 21, so meaning that 21 is added is equal to add 1 day, which is 21 days, then add 1 day, or maybe we say 28, you need to add 7 days. Then if it is 35 days, add 14 days. Okay, then that will bring you to the expected date of delivery. Okay, then under obstetric history, very much important and cardinal, because in here you need to get the history of the current pregnancy. That is the date as calculated from the ultrasounds, the single multiple chronicity, okay, as well as the detailed presenting problem. Then you should also have there been any other problem? Is there been any other problem in pregnancy? So those questions you need to ask and find out your client. Has there been any bleeding? So if your client has been bleeding, it's very much important. And also the other contraindication, or rather the loss of fluid vaginally. You need to ask such kind of a question because they're very much important as you are obtaining the history taken in obstetric and gynecology. Then also the past obstetric history. This one, the thing that you need to consider, there are six things that you need to consider under the past obstetric history. The date of delivery or the pregnancy termination. That one is also very important. Location of the delivery or the pregnancy termination. Duration of gestation. How long did the gestation took? You need to record them. Were they recorded in weeks, or when they correlated with birth weight? So this information allows an assessment of fetal growth pattern. So the gestation age of any spontaneous abortion is of importance in any subsequent pregnancy. Okay. Then type of delivery. So on the type of delivery, we have method of terminating pregnancy. So this is just the type of delivery, or maybe the method of terminating pregnancy. So this information is important for planning the method of delivery in the present pregnancy. Then number 5, you need to look at the duration of labor. Like what was the duration of labor recorded in hours? So it has to be recorded in hours. Like this may alert the physician to the possibility of the usually of the unusually long or rather short labor, because you know you are you are aware about the past obstetric history of the client that you're dealing with. Then if there is any type of anesthesia, the types of anesthesia, any complication of anesthesia should be noted. This one is very much cardinal. So before your client is also admitted for the operation one not and or even for the labor ward, you need to know all this information as a clinician. Okay. Then past obstetric history continuation. Number 7, maternal complication. You need to know, as your client have maybe develop any urinary tract infection, the UTI, or maybe any vaginal bleeding, hypertension, or postpartum complication. This may be repetitive. So if they had developed these conditions before, it can be repeated in the other pregnancy. So you need to observe, you need to check of these maternal complications so that you come up with the proper management on how you can manage such kind of complication. So such knowledge is helpful in anticipating the prevention of the problem with the present pregnancy and how you can manage them. Then 8, the newborn weight. Newborn weight is also very much important. It can either be in grams or in pounds or in ounces. Okay, so this information may give indication of gestational diabetes, fetal growth problem, or shoulder dystocia, or even cephalopelvic disproportion. Okay, so all these are very much important. So this information just gives indication of gestational diabetes and fetal growth problem. Okay, the newborn gender, it's also very important. You need to know the gender. Is it a male or female? Okay, so this may provide the insight of the patient and the family expectation, and this may indicate the certain genetic risk factor. Yeah. Then 10, we are referring to the fetal or rather neonatal complication. So you need to check if at all there is any injury that should be made as to whether the baby has had any problem after it was born, or whether the baby breathed and cried right away, or whether the baby breathed or rather cried right away upon delivery, or whether the baby left the hospital with the mother. So all this information is very much important. Okay, so obstetric history, gynecological history. So under gynecological history, we have things to consider: the period, which is just the regularity. Okay, so period, consider regularity. Contraceptive history. So under contraceptive history, you need to ask your client, as your client have had the family planning contraceptive pills, like the oral contraceptive that are taken during early pregnancy, have been associated with birth defects. Okay, and also they also retain the intrauterine device, which is the IUDs. This can cause the early pregnancy loss, infection, as well as the premature delivery. Then the other part is just the prevention of infection and their treatment. So when was there, again, you need to ask your client, like, when was their last cervical smear? Okay, and was it normal, the cervical smear, when last did they had it? And was the smell, was it normal? Yeah, was it normal? And have there ever been any other, have there ever been any that were abnormal, anything that were abnormal? Or if yes, what treatment has been undertaken? So all this information is very much cardinal. It's very much important for you as a clinician to have it in your fingertips. Then you should also ask the previous gynecological surgery. like the previous one, was it a cesarean section, or maybe it was just the normal delivery? So all this info is very much important and cardinal to the clinician. Then the other one is past medical as well as the surgical history. This one is important in as much that it helps to understand the relevant medical problem as well as the drugs. In addition to the common disorders such as diabetes mellitus, hypertension, and the renal disease, which are known to affect the pregnancy outcome. Again, you should also consider any previous operation, the type of the anesthetic used, or any complication you need to check. Then also each surgical procedure should be recorded chronologically. So the surgical procedure should be recorded, they should be recorded chronologically, including the dates, the hospital. So you record the dates on which that surgery took place. So you record the date and the hospital, the name of the hospital, the surgeon who was there, and if there was some complication, they also need to be recorded. Also, the trauma must also be listed if at all a patient or rather your client has had any trauma. Like for example, we can have a fractured pelvis may result in diminished pelvic capacity. Yeah, so a fractured pelvis may result into diminishing pelvic capacity. Okay, then the other part is psychiatric history. Psychiatric history is also very important because this one, and there are three major things that we consider under psychiatric history. The first one is postpartum blue or depression, as you need to ask your client if at all they've had depression during pregnancy or even the past previous pregnancy. Then depression unrelated to pregnancy. Ask your client if at all they've had depression due to the depression unrelated to pregnancy. Then besides that, you should also be able to ask if your client have had major psychiatric illness. Then so that is under psychiatric history. Then we also have the family history. So under family history, you need to ask your client if at all they've had diabetes, hypertension, also thromboembolic diseases, as well as any other genetical problem and psychiatric problem just from the family background. So this information is very much important to the clinician. Then you should also consider the social history for your client. So you need to ask the status about their social history. Ask your client if at all they smoke, they drink alcohol, or maybe they use illegal drugs. So all these things are very much important because they will help you to ascertain the health of the child, or rather the developing fetus. Then also exposure to domesticated animals, particularly the cats, which may carry a risk toxoplasmosis. Okay, so remember these cats sometimes they act as vectors where they usually carry pathogens. Okay, so these you need to ask if at all your client has ever been exposed to domesticated animal, particularly the cats. Then also exposure to solvents such as carbon tetrachloride, or insulators such as polychlorobromide compounds, or even polyvinyl chloride. All these things are very much cardinal under the social history. Then under social history, you should also ask your client about their marital status. Are they single, divorced, or maybe they are just they are widow and whatnot. Yeah, so all that part is very much important. Then also occupation of your client. This one also is another cardinal interesting part. You need to ask your client about their occupation, where they are working from and whatnot, because it also have other medical importance that will attribute to the fetal development. Then you should also ask them about their sexual history. the healthy of, or rather the current relationship with either the husband or the partner may provide the insight to the present complication. Injuries should be made regarding any pain that is dyspareunia or dysuria associated with sexual intercourse, or rather sexual satisfaction, should be discussed tactically. Okay. Then drug history is also very much important. So drug history, you need to ask your client the type of drugs that they've taken, because the drugs also have another effect on the fetal development. As well as, is your client, ask them about the allergies, the substances that usually makes them to develop an allergy. This one is also very much important. Okay. Then in summary, we can say general examination. So you need to do the general examination, abdominal examination, lower limb examination, as well as the pelvic examination. Okay. So general examination, what is it that you need to do? You need to check the weight. Get the weight, that is, record the weight, okay? Record the height, okay? Record the weight in kg, as well as the height in meters squared, okay? In meters squared, okay? Then vital signs. You should also take note of the vital signs, that is the temperature, the pulse, the respiratory rate, and the blood pressure. Then also you need to assess the cardiovascular examination, where you check the routine of auscultation of the maternal heart sounds in asymptomatic women with no cardiac history is unnecessary. So for those women that are symptomatic, okay, that are symptomatic without any history of cardiovascular disorders, that one, okay, this one is also unnecessary. Yeah, but if at all your client have had any history of cardiovascular disorders, this assessment is very much important and you should not avoid it. Then also the breast examination. Examine the breast of your client. So in here you check the formal breast examination, which is just okay, sometimes it's not necessary, sometimes self-examination is reliable as regard to the general physician examination in detection for breast mass. So this one usually helps in assessing if at all your client have had breast cancer, developing any breast mass. Okay, so do not wipe the ABCDE. Okay, so do not forget to wipe the ABCD as well as the vital signs. Okay, so these are just the weight, then you also inspect the height, and then it goes. So these are just the acronyms, okay? And the vital signs, don't forget. Then under abdominal examination, so generally in abdominal examination you go for the general instruction, where yes sir. Okay, so under the general instruction here, and on abdominal examination, you go for the general instruction. In here you should be able to be on the right side of the patient to facilitate the movement in the right arm. So examination is done by use the palm of your hand rather than the tip of the finger. Okay, so you use the palm of your hand rather than the tip of your fingers, with warm hands, exception in some maneuverers. Okay. Then the other part is so as you are using your palm. Then also engage the patient in conversation to decrease the rigidity of abdominal wall. Okay, if at all there is some rigidity in the abdominal walls, and you should also examine the inguinal canal as well as the inguinal lymph node if there is any swelling in the lymph nodes. Then position and exposure. The patient should lie flat with slightly raised hands, slightly raised head on a pillow, and the knee should be drawn up to decrease the rigidity of the abdominal wall. So the abdomen is divided in 9 quadrants. Okay, so we've got the 2 ventricle line and the mid clavicular plane with extended which extends from the mid clavicular to the mid inguinal, and also to the horizontal line in the upper horizontal line, which is also spylodic plane at the level of the first lumbar vertebral, bisect the distance between the umbilicus and the xiphisternum. Okay, the xiphosternum, we have the xiphoid, so that's the sternum there. Then the lower horizontal line, we have the intercrestal plane extends to the highest point of the iliac crest. Okay, so if at all there are any question, so this just brings us to the end of our session today. I want to make it wrong, so we'll end here for today.